During surgery. Here are some questions you may have concerning your cardiac surgery. What exactly will happen in the operating room? In this section, we will discuss what to do on the day of surgery, what will happen in the operating room, including different stages and steps, and the different types of cardiac surgery. On the day of the surgery. For patients who are out of the hospital, it is very important to make sure you arrive at the pre-op clinic on time. It is even better to arrive a little earlier. If you are already in the hospital, a staff member will pick you up in your room and bring you to the operating room. A few hours before your operation, you may receive a sedative to help you relax. You may need to take other medications if necessary. On the morning of the operation, it may be possible that your family can come for a short visit. Please verify with a staff member. Before you leave for the operating room, you may already have an intravenous in your arm to give you certain medications. When you are in the operating room, your family members may stay in a waiting room or come back to the hospital after the operation. Please verify with a staff member. Operating room. What happens in the operating room? There is a whole team present for you and your well-being. The cardiac surgeon is the person who will operate on your heart, and there's always someone to assist. The anesthesiologist is the person who will put you to sleep, monitor you, and administer the necessary medications throughout the surgery. The perfusionist is the person in charge of the heart-lung machine. The nursing staff are there to support the logistics of the operating room. Preparing for cardiac surgery. Don't be surprised. It is cold in the operating room. This is normal. The anesthesiologist will put you to sleep and intubate you, putting a tube in your mouth to help you breathe during the surgery. They will then place an intravenous line in your arm and another one on the side of your neck to give you the necessary medication for the operation, and will adjust it as needed during and after the operation. There will also be an arterial line placed in your wrist to take blood samples and measure your blood pressure. Step 1. Preparing the vessels for surgery. After making a vertical incision on your chest, the surgeon will open your sternum to access the heart. Usually, in the case of a bypass, the surgeon or the person assisting them will remove a vein from the leg. The mammary artery, which is in your chest, may also be used. It is possible that another artery, such as one in your arm, may be used. Step 2. Connecting the patient to the heart-lung machine. The cardiac surgeon will connect you to the heart-lung machine. Your heart will then be stopped to allow the surgery to be completed. This machine allows blood to flow through your body using a pump, and in fact, the heart-lung machine does the job that your heart and lungs normally do. The average surgery takes 4 to 5 hours. However, the more complex a case is, the longer the surgery can take. We will talk about the different types of cardiac surgery in the next section. At the end of the procedure, both sides of the sternum will be put back in place and secured with wires to make sure everything stays in place afterward. Types of cardiac surgery. What are the different types of cardiac surgery? There are several types. In this section, we'll explain the following common cardiac surgeries. Coronary artery bypass graft, or CABG, also called bypass surgery. Aortic, mitral, or tricuspid valve repair or replacement. Aortic replacement for aneurysm, or a combination of any of the surgeries listed. Let's see what is a bypass surgery. Why do I need bypass surgery? What is it for? Bypass surgery is the most common cardiac surgery. You need it when your arteries become too narrow or blocked due to plaques. Bypass surgery is like making one or more small bridges to go around what is blocked in the artery in order to bring oxygen-rich blood to areas of the heart that are lacking it. In this way, blood flow to the heart will be restored. These small bridges come from a vein or an artery that was taken at the beginning of the surgery. A patient may need one or more bypasses, depending on the number of areas that are blocked. Let's talk about cardiac valve repair or replacement. Why do I need a valve repair or replacement? What is it for? This type of surgery is an intervention that treats diseases that affect the aortic valve, mitral valve, or tricuspid valve when one of the following two possibilities have occurred. First, one of these heart valves does not open completely. As a result, the blood cannot flow freely, preventing the valve from functioning properly. Second, one of these heart valves does not close completely. As a result, more blood remains in the same chamber of the heart, making it difficult to circulate blood in the body as it should. If it is not possible to repair the defective valve, it will be replaced by a mechanical valve or an organ tissue valve. The mechanical valve. The mechanical valve is made of synthetic materials. It is often used for younger people and lasts a long time. It is important to know that this valve makes a ticking sound. Patients must also take blood thinners for the rest of their lives following this surgery to avoid blood clots and the risk of stroke. The organic tissue valve. Regarding the organic tissue valve, it comes from pigs or cows. This valve has been processed so that it is not rejected by the body following the surgery. The lifespan of the organic tissue valve is 15 years on average. This depends on the type of valve used and the age of the patient. It is often used in older people and is silent. Unlike the mechanical valve, it does not require the use of blood thinners for life. You can discuss with your cardiac surgeon the best choice of valve depending on your health and your condition. You must certainly be wondering if the replaced valve can be rejected. It is very rare for a valve to be rejected by the body. Let's see the aortic replacement. Why do I need an aortic replacement? What is it for? This procedure is necessary when you have an aneurysm of the aorta. An aneurysm is a dilation or swelling of a part of the aorta. The wall of the aorta that is damaged becomes weakened. When we talk about ascending aortic aneurysm, the bulge is at the top of the heart. You will need this type of cardiac surgery to prevent the aneurysm from growing and to prevent the rupture of the aortic wall. In this case, the cardiac surgeon will replace the damaged aortic wall with a tissue graft that has been treated. It is important to know that you may also have a combination of the surgeries mentioned. For example, you can have 2 bypasses and aortic valve replacement. What are the risks of having cardiac surgery? All surgeries carry a risk. The risks associated with cardiac surgery are heart attack, infection, arrhythmia, renal failure, stroke, bleeding, or death. Keep in mind that the risks of open heart surgery differ from patient to patient, so it is important to talk to your cardiac surgeon. What will cardiac surgery help or improve? In general, depending on your case, the different types of cardiac surgery can help relieve or improve chest pain, shortness of breath, jaw pain, upper back pain, lower chest pain, pain in the upper abdomen, dizziness, fainting, extreme fatigue, swelling of the ankles, among others. As mentioned previously in the video, after a cardiac surgery, the length of stay in the hospital is usually 4 to 5 days, depending on your condition. You will begin physiotherapy starting the first day because it's very important to sit up and walk as early as possible after the surgery. Some days will be more difficult than others, but you'll also have good days. Each day you will gain strength and make progress. As you recover, you'll be able to appreciate the full effects of the surgery more and more. Be patient and try to keep your spirits up by staying positive.